Now we are joined via phone by Dr. Edward Bertram. He is a neurologist and professor of neurology at the University of Virginia and Secretary General of the International League Against Epilepsy. Dr. Bertram, welcome to the show.
Thank you very much. Thank you for giving us this chance to talk some about epilepsy.
Absolutely. Listen, when we hear about epilepsy, we often think about seizures, which is really a characteristic of the condition. But talk to us about this disease and the fact that it's not just about seizures, right?
Correct. I mean, when everybody thinks about epilepsy, what they always picture is somebody falling down and getting stiff all over and jerking in a grand mal seizure is what a lot of people call them. Mm-hmm. And that's a very scary thing to see. But there are lots of other different types of seizures in which people will just sometimes stare. The typical one that people always think about is what are called petit mal or absent seizures in children with the fluttering eyes. But it really is, the seizure is really just it's a few minutes, and sometimes it happens every few months or even less than that. But the impact of epilepsy on a person's life is huge in terms of how they're perceived and what they're allowed to do in many countries. As we say now, epilepsy is more than just seizures.
So what causes epilepsy? Is it a genetic condition? Is it something that one can develop over the years?
There are lots of causes. And although there are clearly some forms of epilepsy which have a major component of genetics, and there are really clearly some genetic causes of epilepsy. Many other people get it for other reasons. Sometimes if there is in a child, if there is an injury at birth, or if someone has an infection around the brain, this will cause damage, which can sometimes lead to seizures. Sometimes when the brain is developing, there are a few areas that just don't quite form correctly, and that little spot can cause seizures. And that's all that it does. And then as people go through life, brain injuries will cause seizures as well. And aging can also bring on epilepsy. The causes of epilepsy vary a little bit by the age of the person. Typically, epilepsy is thought of as a childhood disease, and not much after that. But in fact, the elderly are also very prone to epilepsy as well. So again, there are a lot of different causes, and one of the things that we look for when someone comes to us with possible epilepsy is what's causing the seizure to happen.
So talk to us about management, given that there are different ways that the disease develops. What about treatment and management? How do that differ according to the type?
Well, there are certain types, such as the childhood absent seizure, which is, again, the child will have these frequent brief staring spells. And there's a very specific choice of medicines that you want to use. Other than that, really, the medicines that are available for most of the other types of seizures are roughly equal, and it's a matter of just recognizing that the symptoms that somebody are having are the symptoms of a seizure, and then choosing which medicine best fits that particular patient. There's no best medicine for epilepsy in most cases. It's the one that works for the patient and also the one that the patient can have access to, which is also a big issue in many parts of the world. People just can't get to the medicines that would be helpful to them.
Dr. Bertram, before we wrap, what are the biggest challenges and what do you hope to see in the management of epilepsy in general?
I think the biggest challenges we have, first of all, are recognizing that someone has epilepsy. But in many parts of the world, it is simply getting access to appropriate treatment. In many cultures around the world, epilepsy is not viewed as a medical condition, but more of a spiritual situation. And it makes sense in many ways. Most people think of disease as something that you have. It happens and goes on for some days or weeks or months, sometimes more seriously. But then it's over. But epilepsy is something which happens briefly and then goes away for a while and then happens again. And in many parts of the world, this is sort of viewed more as some sort of a sign of a spiritual event. And perhaps the biggest challenge we have in getting treatment to many people is just for them to recognize that there is a medical treatment for it. This is a medical condition, and that there are medicines for it. But that's a long education process, because people believe in certain things in terms of what causes epilepsy, and it's much more difficult to them, for us, to educate them otherwise. So the biggest challenge, perhaps, everywhere is just education, getting people to know that there are treatments and that it is a medical condition. And then the second big challenge is, in many places, is just having the medicines available. In many countries of the world, medicines are not available, or not available regularly, because people have to take their medicines every day. So those are the two big challenges.
Okay. And